what are your thoughts about fasting for both health and for weight loss? And I'm not just talking about an extended period of time, like a 3 or 5 day fasting, but even on the daily basis, what are the difference in terms of health and weight loss in between eating, for example, 3, 4, 5 times a day compared to eating one meal a day?
Yeah. Well, the most benefits that you get, most of the benefits you get from fasting just come from not eating things that are harmful to you and being in ketosis, in the right metabolic state. So the majority of benefits that you get um, from fasting, you just get automatically from being on a ketogenic carnivore diet, and you get further benefits by doing this because you're actually getting nutrition. Now, when you get down to like the day to day, where people talk about like intermittent fasting, where maybe they have a like an eating window, an 8 hour eating window, a 4 hour eating window. Um, on a carnivore diet, again, I always coach people just eat as much as your body tells you to. Eat as much fatty meat until it starts. Eat fatty meat until it stops tasting good. Eat as many times during the day that your body tells you to. Typically, that will be once a day for many people, especially if they're losing weight or they're more sedentary. If you're putting on muscle and your body wants to put on lean body mass, you will probably have to, and you're working out a lot, you'll probably have to eat twice a day, sometimes 3 times a day. If you have your gallbladder removed or you've had a gastric sleeve or something else that prevents you from eating as much as your body needs in one time, you're going to have to eat more often during the day. Now, if you're grazing and you're not eating maximally, if you're eating fatty meat until it stops tasting good, you typically won't need to eat more than once or twice a day. So you will automatically go into those tight eating windows. And you do get a bit of a bump in your insulin from protein, not from fat. Doesn't matter what anybody says, and that can have a bit of a bit of an insulin response, and that's good. That's physiological. If you're eating multiple times a day and you're grazing and you're doing that sort of stuff, you actually sort of keep balancing up that insulin. You're not going up and then down and normalizing. So you're actually sort of staying a bit up. And so that can cause a bit of an issue. So sometimes people are eating basically the same stuff, but they're sort of having a couple eggs in the morning, maybe having a this and later, maybe having some, beef jerky then, and then doing this. And they're just sort of grazing all day. And they sort of keep just popping up their insulin. They can actually have a bit of an issue. Might stall weight loss. They might actually put on a bit of weight doing it that way. So that's why I say eat fatty meat until it stops tasting good. Eat no animal is going to stop eating just because. There's just like someone's going to tell them they're going to eat until they're full and then they're going to stop. No lion is going in. It's like, I should probably stop. I'm trying to lose weight. It's like, that's not what they do, right? They're going to just eat until it stops tasting good. Okay, so we eat until we stop tasting good, and you sort of get those same results. So you sort of automatically go into an intermittent fasting window, but you're not fasting per se because you're not withholding food. I wake up in the morning, I'm not hungry. It's 2 p.m. now. I haven't eaten today. I'm not hungry. It's fine. I still feel fine from last night. And later on today, I'm going to go to the gym and have more work and things like that. And I'll eat after I go to the gym, and that'll be fine. Right. So I'm eating on a 23-hour, break, right? I'm one on, 23 off, right? Because I'm just eating once. Right. And so that's sort of an automatic thing. Yes, but you can find that if you're sort of grazing throughout the day, that can cause a bit of a problem. Now, some people have to do that because they don't have a gallbladder, or they have a gastric sleeve, or some sort of other surgery, or something else, that gastroparesis, some other sort of issue that they're still healing from. It might be an issue. But those aside, just sort of eat more naturally. And yes, if you're sort of grazing, that can keep your insulin a bit up when you don't want it to be. As far as multi-day fasts, I don't see much of a benefit of that on top of carnivore. If you fast too much, you can actually slow down your metabolism. I actually had a patient that did this, and they had a trainer that they worked with, and they're trying to lose weight. And first of all, they went carnivore and actually lost a significant amount of weight, but then they sort of fell off of it and they started gaining weight again. And so they worked with a trainer who sort of got her back on a similar sort of more meat-based approach, but had her fasting, basically alternate days. So there's 48-hour fasts all the time. And yeah, she lost weight. She lost a significant amount of weight. And as soon as she started going back to eating just carnivore, but on sort of a daily schedule, weight came woof right back up. She regained half the weight she just lost. And then she was like, oh, what the hell's going on? Now she had to go back to fasting again because it actually slowed down her metabolism. And so you slow down your metabolism by eating too little. And you'll lose weight. You're sort of forcing it, but eventually that'll level off because your metabolism will slow down enough that it's like, okay, it's just going to re-norm. Like, okay, this is how much we're eating. Well, this is where we're staying. And less is coming in, less is going out. That's all there is to it. And then when you start eating more and you start eating more than something that your body wants, it says, oh, okay, yeah, we need to store this. So that's what happens. So if you fast too much, you can actually slow down your metabolism. Now, if you do it like our ancestors who may not have gotten food every day because they were hunting and things like that, or the Mongols, like Genghis Khan and the Mongol horde, they would often go 5 days without eating, just ravaging the countryside, and then eat 10 pounds of horse meat in one go, and then do it again. So that's sort of that feast and fast sort of premise. You don't have to fast, but we're certainly capable of it. We're certainly physiologically adapted to that. All animals are, all life is, because you don't necessarily get a chance to eat it. And whales eat, for several months out of the year, and then they come down, like the humpbacks come down to Western Australia to have their babies, and then and the mothers aren't eating for months and months and months at a time, and they're actually giving enough milk that these babies are growing hundreds of pounds a day because of the amount of milk that they're drinking, right? And it comes out like toothpaste. It's like 50% or more fat, right? It's really, really thick stuff. And so for months they're not eating and they're just living on their fat stores, and then they go up and then they start eating again. Great. As long as you're eating enough on the other side of that, then you're okay. But I don't think you need to. I don't think you have to. And so if your body's telling you to eat every day, eat every day. As long as you're eating the right thing, that's okay. And just eating, maximally, so you're only eating sort of once or twice a day. That's fine. Also, what are your goals? Are your goals to lose weight? Are your goals to put on muscle? Are your goals just to be healthy? Either way, you eat fatty meat until it stops tasting good. You do that as many times during the day as your body's telling you to. If you fast too much, you could slow down your metabolism, especially if you're eating less on those other days. You can start actually putting on weight. Some of the benefits can be for specific medical issues, so like cancer, because you're trying to starve out those cancer cells. You're trying to get your ketones up and your blood sugar down, and fasting can help with that, even on top of carnivore. And also, cancer cells can live on glucose. They require 400 times the amount of glucose as normal cells. It's called the Warburg effect. And so that's why you want to go ketogenic. There's something called ketogenic metabolic therapy, which is the new treatment line for cancer that some top institutions like Cedars-Sinai are using now. And that's just simply, reducing and limiting the amount of energy that's available for those cancer cells, right? So you're eating hundreds of grams less carbs a day, and that's hundreds of grams less carbs that those cancer cells can run on. Cancer cells can also run on glutamine. We make a bit of glutamine. We also make a bit of carbohydrates. You're not going to completely eliminate their food supply. They can't run on ketones because they don't have functioning mitochondria, and you have to have mitochondria to burn ketones. But it can run on glucose, it can run on glutamine. Okay, so you're going to make a bit of glutamine, you're going to make a bit of glucose anyway. So cancer cells are going to get a bit of nutrition, but not as much to meet their metabolic demand. And so often they can actually die off, which is great, and they can help your body fight these things off too. Also, carbohydrates shut down your immune system. So studies have shown that sugar of any source, 100 grams, can actually shut down your immune system for up to 5 hours and can damage your glycocalyx, which is in your arteries and things like that, and can predispose you to heart disease, etc. So not great. And it also feeds cancer. Glutamine, you can't really avoid it. You eat plants, you eat meat. Glutamine is sort of ubiquitous. It's an amino acid that's sort of available in both plants and meat. And so doing carnivore or not doing carnivore, you're still going to get glutamine in your diet. Okay, so fasting could potentially limit the amount of glutamine further. And so if you're dealing with cancer, potentially fasting for periods of time can help. And people do find that fasting as part of their protocol seems to help. It keeps your GKI down, the glucose ketone index down. And that seems to be something that does help with longevity and survival and recovery from these things. So I think and then things like epilepsy. When people that we've been using ketogenic diets for a century for epilepsy, and it works. It works really, really well. In fact, that was the best treatment we had, the only treatment we had until we came up with pharmaceuticals. And it wasn't like, wow, these pharmaceuticals work so much better. It's just these work good enough. These work as well. So let's just use these, because it's harder to get people to change their diets. And also, it's things like, here, just take this pill, you'll be fine, as opposed to sitting down and talking to them about physiology and nutrition for 15 minutes. It's easier for the doctor to write these things out. And so it switched over to that. But ketogenic diets work really well for epilepsy. And I found that carnivore diets work even better because there are triggers for seizures, like caffeine, coffee. I've seen people that were ketogenic, massively improved their epilepsy control, their seizure control. Then they went full carnivore and they had no issues. They came off all their medications. One gentleman had 1 cup of coffee and bam, had a massive grand mal seizure and was in the hospital. So there are other things outside of carbohydrates that can elicit a seizure. And so some people find that being in deeper ketosis, so very high ketones, that helps protect the brain. And ketones are neuroprotective. And so if you're not getting as good of seizure control, you can think about periodic fasting or narrowing that eating window, just eating once a day, maybe taking a couple of days off, or doing 48-hour sort of spreads, but eating enough at those times. That could potentially be an instance that could be beneficial. Otherwise, I think that as long as you're not grazing and you're eating maximally, during those times, that you don't need to fast. You can fast. Our body's more than capable of doing it. But if you're going to do that, make sure you eat enough on those days that you are eating, because you can absolutely slow down your metabolism and end up being a problem. And I tell people that you want to increase your metabolism, you want to improve your metabolism, you just eat enough and you give your body what it needs, and your metabolism goes up and people lose weight. And that's what I see in literally thousands of patients and consultations that I've had, working with over 10,000 people in these various groups, but I'm talking one-on-one with thousands of people. This is what I'm seeing, and that's what the evidence and science shows us.